Diabetes is a chronic condition that affects millions of people around the world. It is characterized by high blood sugar levels due to the body's inability to produce enough insulin or use it effectively. Diabetes can cause a wide range of health problems, including heart disease, kidney damage, nerve damage, and vision problems. In this article, we will discuss the causes of diabetes, methods of elimination, and how to live with diabetes, including foods that are dangerous for people with diabetes. Causes of diabetes. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes is caused by an autoimmune response that destroys the cells in the pancreas that produce insulin. This type of diabetes is usually diagnosed in children and young adults. Type 2 diabetes is caused by a combination of genetic and environmental factors, such as obesity and a sedentary lifestyle. It occurs when the body becomes resistant to insulin or does not produce enough insulin to regulate blood sugar levels. Methods of elimination. There is currently no cure for diabetes, but there are ways to manage the condition and reduce the risk of complications. For type 1 diabetes, insulin therapy is the primary treatment. People with type 1 diabetes need to take insulin injections or use an insulin pump to manage their blood sugar levels. For type 2 diabetes, lifestyle changes are the first line of treatment. This includes losing weight, increasing physical activity. Living with diabetes. Living with diabetes requires careful management of blood sugar levels through regular monitoring, medication management, and lifestyle changes. People with diabetes should work closely with their healthcare providers to develop a diabetes management plan. Here are some tips for living with diabetes. Monitor blood sugar levels regularly. People with diabetes should test their blood sugar levels regularly to ensure they are within the target range. Take medication as prescribed. If medication is prescribed, it is essential to take it as directed to manage blood sugar levels effectively. Eat a healthy diet. A healthy diet is an essential part of managing diabetes. Foods that are high in sugar or carbohydrates can cause blood sugar levels to spike. Exercise regularly. Regular exercise can help improve insulin sensitivity and lower blood sugar levels. Manage stress. Living with diabetes can be challenging, but with the right lifestyle changes, medication, and support, it's possible to manage it and live a full and healthy life. Remember to eat a healthy diet, exercise regularly, monitor your blood sugar levels, and work with your doctor to find the right treatment plan for you. Thanks for watching, and take care.